What's going on, guys? Welcome to our daily show where we discuss the fourth stimulus check update, what's going on in the United States, Washington, D.C., money, investing, and the next stimulus package that has been announced at $3.5 trillion. And the House of Representatives is now working towards the final stages and will be voting on it possibly this upcoming week. They're putting the bill together. The 13 subcommittees have put their portions of the bill together. They are now drafting the final stages of the bill, and we could see the final passage in the House of Representatives this week. I'm going to give you the latest details of that, as well as what is going on in our country in this video. Representative AOC, Alexandria Ocasio-Cortez, has drafted a bill to reinstate the federal unemployment benefits, the $300 per week unemployment boost, and to extend extra weeks of unemployment benefits to be included in this $3.5 trillion stimulus package and to have it added in to this package. Yes, they are trying to add this into the $3.5 trillion stimulus package. These unemployment benefit bonus money, $300 per week, would be extended until February 1st and would have $300 per week retroactive unemployment bonus checks back to Labor Day weekend, September 6th, if passed. If passed and if added into the $3.5 trillion package. AOC, Alexandria Ocasio-Cortez, and Representative Bush are pushing to add extended unemployment bonuses into the $3.5 trillion spending plan. So this is something that some of the progressive Democrats are trying to have added into the stimulus package here at the last moment. There's going to be a lot of different ideas trying to be added into the stimulus package here at the last moment. I will keep you up to date on all the different ideas as they come forward. Another thing that is trying to be added in at the state level is in the state of Pennsylvania. State Representative Austin Davis will introduce legislation to reinstate and fully fund unemployment assistance program, which recently expired. So in the state of Pennsylvania, a state representative is introducing legislation to reinstate unemployment assistance in the state of Pennsylvania. That's correct. Now, again, both of these are just proposals. And of course, proposals are not set in stone. That does not mean they've passed. I will keep you up to date on this. The unemployment on the federal level is trying to be added into the $3.5 trillion stimulus package. If it's added in, that just means that it will pass with the stimulus package if passed. So really, the bigger idea there is if it's added in, would be a major thing just to be added into the stimulus package. So I will keep you up to date on that, because if it's added in, that's a huge thing, because that would mean it's just in the package. Because if it's in the package, that means it's going to pass with the stimulus package, yes or no. So just being added into the stimulus package would be a major thing, because then it's going to pass with the package, whether the package passes or not. So the package is expected to pass. Even President Biden here said the other day that he expects Congress to approve the spending and the infrastructure bills. So even President Biden himself says he expects both the physical infrastructure bill and the stimulus package, the $1.2 trillion physical infrastructure bill and the $3.5 trillion stimulus package, to both be passed here within the next coming days. Both of them could be passed here within the next week. That's correct. We have a date set of next Monday, not this upcoming Monday, but September 27th, of a voting date for the physical infrastructure package. Okay. But the stimulus package, the $3.5 trillion stimulus package, is supposed to be passed before then. So this next upcoming week is supposed to be a very critical week, because they're supposed to be passing the stimulus package before the physical infrastructure package. The physical infrastructure package has a date set in stone. Well, you know how that goes. We'll have to see. But this has been long promised to the moderate Democrats, and September 27th is the date set in stone, like the sword in the stone. They're going to vote on that, but whether they're going to vote on the stimulus package before then, which is basically this upcoming week, because the 27th is the next Monday. So they have to either pass the stimulus package in the House before then or on the same day, or else the physical infrastructure package is going to pass before the stimulus package. And that was not the plan. That was not the plan. The plan was to pass the stimulus package first or at the same time, which would mean basically the same day. So basically, we're down to like the final week here where they have to pass the stimulus package either before or on the same day of the physical infrastructure package, because the physical infrastructure package is going to be voted on September 27th, which is basically a week away at this point. Also, they're going to be voting on this week to potentially avoid a government shutdown. And that is by September 30th, they have to vote on preventing the government shutdown, which is an annual budget they have to vote on every year. If they don't do this by September 30th, the government will have a shutdown on October 1st. So they have to do that. They said they're going to start on this week. They could potentially do this, let this go into next week, but they're going to start on that this week. They're also, House Majority Leader Steny Hoyer says that they're going to start on the government default, which is raising the debt limit this week as well. So yeah, there's going to be a lot going on this week. I would suggest not missing any episodes this week because, man, it's going to be absolutely insane this week with the amount of information and stuff that they're going to have going on in the House, while the Senate kind of looks on and says, wow, it's kind of a circus going on there over there in the House. The Senate will have to take on a lot of this stuff, but it looks like the House will be taking on this stuff here first. Yeah, while the rest of the country looks on and says, what is going on over there? Meanwhile, the rest of the country is still kind of crazy as well. The state of Alabama says that they've recorded more deaths than births in 2020, marking a first in state history. Yeah, get this. Alabama, which has been hit hard by, saw more deaths than births in 2020, marking for the first time in the state's population that the population has shrunk ever. Quote, here in Alabama, we continue to see deaths at a higher rate than births, the Alabama State Health Officer Scott Harris said in a press briefing on Friday. Quote, this past year, 2020, is going to be the first year that we know of in our history of our state where we actually had more deaths than births. Our state literally shrunk in 2020 based on the numbers that we have managed to put together, and actually by quite a bit, said Harris. Harris said that Alabama recorded 64,714 deaths and 57,641 births in 2020, according to preliminary numbers. And depending on what side of the fence you're on, you actually might think this is crazier. The White House is debating for air travel. Yeah, get this. The Biden administration is facing an internal debate over whether to impose mandates for air travel, with President Biden's chief medical officer, Anthony Fauci, saying he would support a mandate, but the White House claiming a new policy isn't forthcoming, at least yet. The potential of a mandate for domestic air travel would be fiercely opposed by Republicans and the travel industry, and could add to the pushback Biden has received over his mandate on testing for companies with at least 100 employees. The White House sees the mandate on such businesses as politically popular, but it has run into opposition from Republican governors who have threatened to sue with lawsuits. The administration could see a mandate to fly as an issue that might find some support, but also risk being seen as a government overreach. Dr. Anthony Fauci recently said, quote, I would support that if you want to get on a plane and travel with other people, that you should be vaccinated, end quote, from Dr. Anthony Fauci said on the Skim podcast. White House Press Secretary Jen Psaki said the idea isn't off the table, she said on Thursday when asked about Anthony Fauci's remarks. She said, quote, we haven't taken options off the table, but I don't have any updates to share with you at this point. Our focus is on implementation of the big steps we have announced last week. U.S. House Representative Don Beyer has introduced a bill to require or a negative test for domestic travel on airlines. But again, right now, this is just a proposal, but there is an actual bill that has been introduced to require either or a test on airlines. But right now, it is just a proposal that has not passed, but there is an actual bill. Let me know your thoughts down below in the comments. Do you think that this should be an actual law? Airplanes are close quarters, but I know there's a lot of very mixed feelings about this. Let me know your thoughts down below in the comments. New data is out from the census that said stimulus checks and unemployment benefits significantly lowered poverty in 2020. This data could be used by the Democrats who are going to pass the next stimulus package on their own without a single Republican vote. Remember that the third stimulus check package was passed without a single Republican vote. Not a single Republican voted on the third stimulus check package and the third stimulus check. Not a single Republican voted yes on that. And not a single Republican is going to vote yes on the next stimulus package either. So Democrats could use this data to say that, yes, we need to include stimulus checks and multiple stimulus programs or more stimulus programs than what they are considering putting in this next package, which we still at this point do not know exactly what is going to be in this bill, as they're drafting the bill but have not yet released it to the public. The Treasury Department has also issued a 6-month progress report largely showing the positive impacts of these stimulus payments, stimulus checks, and these stimulus packages. So we have two major reports that have just come out saying, yeah, stimulus has really helped out the economy, really helped out the American people, and yet we're here in a once in 100-year with the really ravaging our country, and yeah, they've really helped, but yet we have a lot of people still really in need. Again, President Biden thinks that Congress is going to pass this next stimulus package and the infrastructure package. There's really been a lot of back and forth between Senator Joe Manchin, moderate Democrats from the Senate like Joe Manchin and Kyrsten Sinema. You know their theme song, right? Da, da, da. As well as some moderate Democrats from the House of Representatives as well. We had 3 different moderate Democrats just in one subcommittee vote that voted no. 3 different Democrats that voted no from one subcommittee out of 25 Democrats that voted no on a subcommittee portion vote on a drug pricing. It was not just the drug pricing, but on a subcommittee portion of a vote that voted no. And what the Democrats actually did is they just took that prescription drug pricing out of that subcommittee and put it in another subcommittee and passed it in that subcommittee. But we did have 3 Democrats vote no there. They took it out and put it in another subcommittee and passed it there. But ultimately, when it goes to the final vote of the House of Representatives, they're going to need all 99% of the Democrats in the House. They can only afford 3 total votes to vote no. So it'll be interesting to see what's going to happen here with this final vote that could be coming this week, if not this week by Monday, or if not by Monday, not this Monday, but next Monday, within the next 8 days. The Democrats are going to have some really soul searching to do, because if not, if they pass the physical infrastructure package first, they lose that little bit of, or maybe more than a little bit of leverage, the lot of leverage that they had. Because remember that Nancy Pelosi's kind of said all along that the physical infrastructure package was kind of this leverage that they had over the $3.5 trillion stimulus package. Well, they're going to vote on that physical infrastructure package on the 27th of September. Tomorrow's Monday. That's the next Monday. So that's in 8 days from now. Okay, so in 8 days from now, if that package passes, it's gone. The Senate's already passed the physical infrastructure package. It goes to the president's desk, and it's gone. So they have to pass the stimulus package within the next 7 to 8 days in the House. I mean, literally, time's flying here. If they don't pass it in the House by then, they're going to lose that leverage of that physical infrastructure package. Okay, and I've always said from the beginning that it's not really needed to have that, but they do have a little bit of leverage there over some moderate Democrats. We've had some progressive Democrats say, well, Joe Manchin, if you don't pass the $3.5 trillion stimulus package, then we're not going to pass your physical infrastructure package. Okay, we've seen a couple people say that. Well, On September 27th, they're going to vote on that physical infrastructure package. If they pass it, that kind of leverage goes away. Now, what could happen? I'm not saying this might happen because we're looking into the future here. Who knows what's going to happen in the future, right? If the stimulus package does not pass by then, because we have a lot of complications here. We have literally 3 Democrats voted no on the prescription drug pricing. By the way, there's a lot of controversy over that because a lot of people are saying that they didn't vote, they voted no on it because they're in the pockets of big pharmaceutical companies. Senators like Senator Bernie Sanders are calling him out on that and saying, why did you vote no on that? Are you being paid off by the prescription drug pricing? And then other people are saying, oh no, it's just because we don't like the wording on it. And it's really hard to tell. It's like there's a lot of lobbying by prescription big pharma saying, oh, we don't like this. We don't. And there's a lot of, there's multiple different tiers of what they're trying to do with big pharmaceutical companies. One of them is they're trying to force pharmaceutical companies to lower their prescription drug pricing by law to force them to sell them the prescription drug pricing to the same prices they sell it to any other country. So if they sell, and I'm just going to pick numbers out of the air here, if they sell insulin to other countries for $10, I'll use this as an example here. This is a famous tweet by Bernie Sanders. The cost to manufacture 1 vial of insulin is around $6. This is the cost for a pharmaceutical company. Okay. And the cost of 1 vial, what they sell it to other countries for is this. Okay. So they sell it to these other countries for this cost. So what is that? Australia, UK, Canada. They sell it to Canada for $12. They sell it to the United Kingdom for $7. They sell it to Australia for $7. But they sell it to the United States for $98. They sell it to the United States for $98. Yeah. Tell me that's not insane. He says the American people should not be forced to pay the highest prices on the planet for prescription drugs. So what they're going to do, what they're trying to do, there's multiple different things they're trying to do here with this prescription drug pricing, is they're going to, by law, they're not asking these pharmaceutical companies to lower their prices. They're going to force them by law. And what the law is going to say here is that if you sell a prescription drug, so in this case, insulin, in this example, if you sell it to any other country for a price, so in this case, $7, if you sell it to anybody else for a certain price, you have to sell it to us for that same price. It's going to be a law. They're not going to go and politely ask them to lower their price. Do you think they're going to politely say, oh, I know you sell it to us for $98 and you have for many, many years. Would you now kindly sell it to us for less? That's not going to work. They're going to pass a law and they're going to say, by law, you must sell it to us for the same price that you sell it to for anybody else. That's how you get the job done. Okay. But the problem is big pharmaceutical companies, they're worth billions and billions and billions, even trillions of dollars. Okay. They got lobbyists out the wazoo and they got money out the wazoo, right? They're not joking around, right? They're trying everything they can, even bribing representatives and senators and lobbyists and throwing around a lot of money because there's a lot of money at stake, right? So they're going to try everything they can to not get this passed, okay? And this is just one portion of the pharmaceutical bill, okay? So one thing of what they're trying to do, this is why it's very controversial, they're trying to get this done, is to force these pharmaceutical companies to sell them. If they sell it to these other countries for $7, there's no reason that they should sell it to us for $98. And the only reason they do it is because they can and they get away with it. And what people like Bernie Sanders, you could see, this is his tweet, this is his exact tweet, is they're trying to stop this. This has actually been going on for many, many years. There's been lots of presidents and lots of organizations that have tried to stop this for many, many years. But nonetheless, they're trying to do it now. And if they do it now, it'll be a win for the American people and the American government because it's going to save the government $600 to $700 billion, and they're going to use it to help fund this next stimulus package. But they have to get everybody's votes on board. And who knows who pharmaceutical companies have gotten to and who they haven't, right? There's 220 Democrats that are all in there. And of course, we're not going to get a single vote from a single Republican. Every single Republican is going to vote no. Not a single Republican wants to lower pharmaceutical drugs for American people. Not a single one. So that's the problem here, right? This is the problem, is that we have to get 99% of the Democrats in the House to vote yes on this entire bill. That's just one portion of the bill, as well as 100% of the Democrats in the Senate. It's a very, very difficult thing to do. So I will keep you up to date on this. I mean, just lowering the prescription drug prices is it's a very, very amazing thing to do. That's just one of the things in this package. And if you take prescriptions, I mean, having them lowered significantly, there's probably going to be multiple different tiers of this. And some of these things might kick in over time. Some of these things might kick in right away. There's also supposed to be like rebates and stuff in there. How it's all going to work and how it's going to all go down once it passes, we'll kind of try to dive through it and figure out all the details. Things are changing by the hour, so I will keep you up to date on this. That's just one of the things in this entire package. Of course, they're working on Medicare 2.0, hearing, dental, vision coverage, hearing aid coverage, denture coverage, lowering the Medicare eligibility age to age 60, stimulus, hopefully a forced stimulus check to be included in there, monthly checks for children, extending the child tax credits, those monthly checks of $250 to $300. Remember, those end at the end of this year. They want to extend that. Okay, those go away at the end of this year if they don't pass this package. Okay, they're also talking about a potential $1,000 voucher check for seniors for Medicare. Yeah, so there's all sorts of things that could be included in this package when all is said and done. But they got to pass the package and then got to get everybody on board to vote yes. And this upcoming week is supposed to be a very, very huge week because they're literally going to start the voting process this week. Make sure they subscribe as well so that they know about all these different things going on with the next package. You can click here to watch my newest stimulus check video next. And this video is how you can get $13,000 from the last stimulus package. And yeah, I walk you through how to do it. So click on one of those videos next. Thanks, guys, and I will see you in the next video. In the next video. In the next video. In the next video. In the next video.